Thank you. What I want to talk to you guys about is what I feel is the best kept secret in healthcare. And the way I want to talk to you about the best kept secret is to tell you a story. And the story is about me. This is a picture of me when I was 5 years old. And this picture has a lot of significance to me because it occurred at the end of the school year, right before I had my first asthma and allergy attack. And so this was back in 1967, 68 or so. And right after this happened, I developed such bad asthma and allergies that I went from being completely healthy to being paralyzed with sickness over and over and over again. And I had to go get inhalers, and I had to go get allergy shots, and I had to go get all kinds of drugs. So by the time I'm 20 years old, I want you to fast forward ourselves, 20 years old, I'm puffing on an inhaler 6 to 8 times a day. I'm carrying inhalers everywhere I go, and I am sick all the time. And I am really scared because I'm petrified of what would happen if I was not with one of my inhalers. And exactly that nightmare came to pass when I was driving home one day from my school in Albany to Lynbrook, New York. Normally, as you can see here on Google Maps, it's about a 3-hour drive. I happened to drive home for the summer in 1984 during an awful thunderstorm. And during this thunderstorm, I had one of the worst attacks of my life because I was so scared. This rain was coming down and the thunder was so loud, I was all alone. So I reached down to the glove compartment to get my inhaler, but guess what? I didn't have it. So I looked in my pockets, I didn't have that. I pulled off to the side of the road, got drenched wet, looking in my backpack, didn't have my inhaler. I had no inhaler, and I was still about halfway, so I had to go all the way, another like 2-3 hours to get back home. A normal 3-hour trip took about 5 hours to get home. By the time I got home, I was gasping for breath because I missed my inhaler so badly, and I ran into the house, didn't even say hi to my parents. I just jumped into the bathroom, got my inhaler, lied there on the floor, and finally was able to catch my breath. And my parents were standing over me like this, going like, Drew, are you okay? And finally, when I was able to contain myself, I said this quote to them: if I am this sick at age 20, what am I going to look like at age 40? And what can my parents say? What can any parent say to that kind of question, right? There's really no particular answer to that. So life went on, and I still kept on puffing on my inhalers. But a few weeks later, my mom decides to go for a chiropractor for back pain, which is the most common reason why most people have seen chiropractors, for back pain. But this chiropractor was a very special guy in Long Island, and he taught my mom what chiropractic really was. And my mom called me from this chiropractor and said, you got to come visit this guy. And I said, Mom, I don't have any back pain. I have all this asthma and allergies, so I don't have any back pain. She said, no, you got to come hear this guy speak. So I went to hear him speak. He gave a little talk a few weeks later. And this is one of the questions that he asked of me that I want to ask of you guys. Are you satisfied with the current direction of your health? And I remember him saying that, sitting in his little audience there in his office, and he said, are you satisfied with the current direction of your health? And I had to answer no. 15 years, I've been puffing on inhalers. 15 years, I got allergy shots. 15 years, I'm taking all kinds of pills. 15 years, my hands are shaking like a leaf from the asthma medication, and I'm getting sicker and sicker and sicker. So I'm doing all the things they said. I'm doing all the drugs and all the things that they said to do, but I'm getting worse and worse and worse. So no, the answer was I am not satisfied with the current direction of my health. I don't know what's going on. And then he said probably one of the most profound things I've ever heard in my whole life. This was a life-changing sentence for me, and I hope it is for you too. If you keep on doing what you're doing, you'll keep on getting what you're getting. If you keep on doing what you're doing, you'll keep on getting what you're getting. So I thought about that as he was saying that. I said, oh my God. For the last 15 years, I've done the same thing over and over and over again, and I haven't changed anything. It's just a different brand of drug, it's a different doctor, a different medicine, a different shot, but nothing was really different. It was all the same stuff over and over and over again. And he said the second most profound thing I ever heard, which was this sentence here: if you want something different, you got to do something different. If you want something different, you got to do something different. And you probably guessed the end of the story, right? A few months later, my asthma is gone. And now, this year, 2014, is the 30th anniversary of my last asthma attack. So I have been now alive 30 years without asthma. And before that, I was alive 20 years with it. So now I'm going way past where I used to be. And from what they told me back then, they said this is a lifetime intractable thing. But in 3 months, my asthma was gone. So maybe it started me thinking, maybe there's something different that we have to do. And it's not just about me. now. Now they've been in practice for 25 years. It's not just about me. Maybe there's another step that we should be taking. Maybe the first step shouldn't be medicine all the time. Maybe we have to start rethinking how we think about healthcare in this country. And I want to bring up a really important point because I've been doing a tremendous amount of research about this. And I don't know if you guys saw this. This was released last year in January 2013. U.S. Health and International Perspective, Shorter Lives, Poor Health from the National Research Council of the Institute of Medicine. This is a huge government body that did this amazing body of research. And what this research shows is that the United States, in international perspective, even though we should be one of the healthiest countries in the world, we're not. So here's the example. Life expectancy. They measured the top 17 countries in the world in terms of wealth. So we are, of course, the wealthiest country in the world, but are we the healthiest? No. In terms of men, we are the worst, and in terms of women, we are the second worst in terms of life expectancy in the world. However, we are the #1 winner of healthcare expenditures. We spend more than anybody else by far. We spend $2.7 trillion a year on our healthcare, which equates to about 17% of our gross domestic product. And the closest next one, if you look over here, the closest next is Netherlands, who spends 11%. So we by far are spending unbelievable amounts more than anybody else in our healthcare, but we're sicker. So if you looked at this chart over here, if you saw our healthcare spending was going up, but our health was going down, what would that equate to you? Would you say that if we keep on spending, if we spend more money, we would get healthier? So what we have to do is spend even more money, right? And more and more and more. So I would say the direction that we're going right now, if we keep up this way, the direction we're going is we're going to keep on going down in our health and up in our spending, unless we do something different. Unless we do something different. And maybe it's time. Because I appreciate the whole idea of universal access to insurance. I think it's a great idea. However, that's not the answer. That's not the answer. It's not going to get us more health care, but better health. It might get us more health care, but it's not going to get us better health. Here's the great secret. Remember I mentioned this is the best kept secret? Here's the great secret. The great secret is it's not who pays for health care, it's what we pay for. It's what we're paying for. And right now, we're paying for the wrong things. We're paying for the wrong things. So Obama, I know, he said that great line many years ago when during his campaign, it's time for a change. And I absolutely agree with President Obama. He said it is time for change, and it's absolutely right. It is time for a change, but maybe it's not universal insurance. Maybe it's chiropractic. Maybe it's chiropractic. So, and going back to that great article I told you about the U.S. Health International Perspective. So these are the 9 reasons, according to them, not according to me, but according to them, as to why the U.S. healthcare is so poor compared to all the rest of the world. Number 1 is infant mortality and birth weight. 2 is injuries and homicides, and you can just keep on going down the list. These are the major reasons why they believe that the United States is so poor in healthcare. So the other day, this is amazing. The other day, a cancer patient came in. We take care of a lot of cancer patients. One of my cancer patients came in, and she said she was talking to her oncologist. And she said her oncologist, all this guy does always is talk about this disease and this problem and this problem and this problem. She said, can we just talk about something healthy? I would like to do something healthy. Can I please go to my chiropractor? You have not let me go to my chiropractor in months because you keep on thinking about disease, disease, disease. I'm doing something healthy. If I can get to Dr. Rubin, I know I can feel better. And that's the kind of thinking that we want to put not just in our patients, but in the whole country, in the whole world. And then a couple of minutes later, a mother comes in, and she's telling me, she said, I was speaking to one of my neighbors, and my neighbor's kids got all these ear infections and all these other kind of problems, and we didn't know what to do about it, so we're just going to another pediatrician and another ENT, and she said, why don't you try chiropractic? I've told you about chiropractic like 100 times. Why don't you just try chiropractic? And she said, no, this isn't a chiropractic thing, this is a medical thing, and we're just going to have to get more tubes in the ears and more drugs and that kind of stuff. And the mom said, but that was the problem with my kids. Do you remember I told you about that? My kids, when they first came to see Dr. Rubin, one was 4 and one was 6, and they were out of school all the time and sick all the time with ear infections. And now these kids are the healthiest kids ever, and we've been under care for like 10 years. Why would you try chiropractic? And they just wouldn't listen. So that she said to me, she said, that was me 10 years ago. That was me 10 years ago. And that's okay. That's okay, because they don't understand. But my goal is to get people to understand that there is something different out there. There's something we have to do. And what we have to do now is we got to take action. Now we got to take action. So what I'm asking all of you, if you hear a secret, you see a great movie, a movie you really, really love, and you go out and tell everybody about it. Forrest Gump is one of my favorite examples. When we saw Forrest Gump, we told everybody about that movie because it was such an incredible movie. It made such an impact on our lives just watching that whole thing. And I'm telling you the same thing. So if you now have a secret that we've told you, Now you know the greatest kept secret in healthcare is chiropractic. I want you to tell other people about it. You to say, you know, maybe we should start with something different. Maybe if there's a problem, the first place you don't go, unless it's a heart attack or something serious like that, but the first place we should go is chiropractic. Why don't we try chiropractic first? What would hurt? Because right now, if we keep on going the way we're going, we keep on spending more and more money and getting sicker and sicker and sicker, it's just going to keep on getting worse. We got to do something different. It's time for a change. I absolutely believe, like Obama said, it is time for a change, but the change is not in who pays for things, it's in what is being paid for. What's the best healthcare secret is chiropractic. Chiropractic is the best kept healthcare secret, but it's no longer a secret. Now you know about it, and now I'd like you to take another look. Thank you very much.